Through the chair, Minister, how many times did you and the Prime Minister meet to discuss the portions of the budget related to Veterans Affairs prior to its introduction?
The budget process was a comprehensive process that had a lot of engagement with many individuals providing input on the needs of Veterans Affairs Canada and how we could best support veterans.
So how many times did you and the Prime Minister meet to discuss the Veterans Affairs portions prior to its introduction?
Again, there was numerous meetings to discuss the needs of the portfolio and how we best address that. And as we've seen,
numerous meetings between yourself and the Prime Minister?
There was numerous meetings to discuss the needs of the portfolio.
So in those meetings, was it you who advised the Prime Minister to make such deep cuts to Veterans Affairs?
I disagree with your comment about cuts. This is actually an investment in Veterans Affairs of $184.9 million with ongoing funding of $40.1 million to follow.
Well, it's, I will tell you that veterans across this country are concerned because they're hearing about the cuts. And what they're worried about is the fact that your government hasn't been transparent about what those cuts will be, and that leaves them concerned for their services and benefits. Could you maybe perhaps give some transparency and accountability to veterans right now and tell them what those cuts will be?
There will be no cuts to benefits or services for veterans. There is an adjustment that is being made to the rate of reimbursement for medical cannabis from $8.50 to $6 per gram. Okay. There is no cuts to benefits and services.
So you actually are asking veterans to believe that cutting the rate of reimbursement on a $245 million a year program is going to amount to $4 billion over 4 years. I don't think any veteran will believe that, but I don't think we're going to get a different response from you on that. So what I'll do is move. I've got another thing I wanted to ask you about. We've heard a number of different areas of concern where there has been some indication of what your government's going to do, and I wanted to touch on a couple of them and ask you about that. So the first one is with vulnerable veterans in long-term care. Due to a mistake, I think an honest one, made by your department, those vulnerable veterans were overcharged for their long-term care. And the response by your government was to sneakily put into like page 375 of the BIA a retroactive change to legislation that would ensure that those veterans continue to get shortchanged. On the other hand, we have disabled veterans who, again, due to a mistake by your government, were overpaid on IRB. And now they're getting bills for tens of thousands of dollars in many cases, going back 6, 8 years, and being expected to repay those immediately. These are veterans that are vulnerable, they're on a fixed income, maybe dealing with mental health injuries. Perhaps, this might drive them right over the edge. And the commonality in both these cases is veterans are the ones who are getting screwed. That's the commonality in those cases. So I guess I have to ask, why is it your government's reflex always to make veterans pay for your mistakes?
Through the chair, as I articulated in my opening comments and I have said, there is no cuts or changes to the benefits that veterans, or benefits and services that veterans receive.
So are you telling me that these bills that veterans are receiving for tens of thousands of dollars are going to be wiped out then?
Through the chair, if a circumstance has changed in a veteran's life, such as a change in their income levels from a variety of sources, then there may be times where an adjustment is made. And as such, there may be communication with a veteran, and I encourage any veteran who has a question about the services and the benefits that they're receiving, the financial elements of it, to reach out to Veterans Affairs to speak to their specific individual case.
Well, I will certainly encourage veterans to do that, but I can tell you this is a problem that is affecting many veterans. We've heard often in this committee about sanctuary trauma, and this is another example of that sanctuary trauma. Your government is imposing these kinds of things on veterans, and it is having massive impacts on their mental health, and I certainly hope that it won't lead to another veteran suicide, because that is the kind of concerns that I'm hearing out there. Let me turn to something else. In regards to your plans to move to utilization of AI in processing claims of veterans. The government's own algorithmic impact assessment says that the new AI system will apply consistency, compliance, and financial efficiency filters. That means that's coming before human review. We already hear from many veterans who say that there isn't enough humanization in Veterans Affairs. So can you explain in plain language to this committee and to veterans how what you're looking to do differs from the idea of an automated denial of benefits?
Through the chair, the use and the implementation of AI as a tool can help with administrative roles.
Sorry to interrupt. There's not much time left.
Mr. Richards, do you want an answer?
I don't have enough time to listen to something that's not going to really respond.
Actually, you do not have any more time, Mr. Richards.
You've just interrupted me, Chair. I do have time.
You have over 6 seconds already on the clock additional.
I do have time.
Mr. Richards, your time is up. Thank you very much.
Sure, thanks. Let's pick up where we left off before we were cut off. That same algorithmic impact assessment that I referred to earlier states that, and I quote, veteran input data errors may negatively affect outcomes. So what I'm wondering is, why is that sort of a burden being placed on disabled veterans to provide perfectly, absolutely perfectly formatted medical and administrative data? Because clearly that's just going to mean more delays and denials for veterans.
I believe you're circling back to the use of technology and AI to supplement. May I just clarify that? Okay, thank you. With the engagement of these tools, we are assisting with some of the administrative aspects of it, so that the frontline individuals who work with veterans have expanded capacity to engage with veterans.
Okay. I'll let you do it. We were battling over the microphone there. But when it says veteran input data errors may negatively affect outcomes, when I hear negatively affect outcomes, that means to me, and tell you if you think otherwise, I'd love to hear. But doesn't that just mean more delays and denials for veterans? Like if that form isn't perfectly filled out and the AI doesn't get it, this is already a challenge for veterans that find that they're delayed, and there's always a return of a medical form because a doctor didn't quite fill it out right. Like, this is already a problem, and what it's saying is that this could get worse with the use of AI. So what do we say to what do you say to veterans? Like this. They fear this is going to mean more delays and denials, and they're probably right.
Through the chair, my engagement with veterans is around how do we support you to equip you for this process, to reduce barriers, which I believe goes back to part of what you've referenced, but then also how do we look at our processes on the other side to ensure that we are using our resources in the maximum way capacity to be available to work directly with veterans. I believe it's a multifaceted approach of working to improve the system overall.
All right. I don't know that that's going to give veterans any more confidence that they're not going to face worse delays and denials, but I guess we'll have to agree to disagree on that one. I'm going to turn the rest of my time to Mrs. Wagenthal.
Okay, thank you, Chair. We have had testimony recently on suicide with veterans, and through the current study on preventing veteran suicide, we learned that our province of Saskatchewan Legion Command is funding veterans' costs for a successful cutting-edge new treatment regime for PTSD, and being very successful, called Scepter. VAC has refused to fund it. So I'm just wondering, can you tell me, we need to provide what veterans feel works. Are you prepared to listen to veterans on programs that they want to be seen as included in veterans' supports, as options with those providers that are within the Partners in Canadian Veterans Rehabilitation Services. Are you open to hearing and suggesting moving forward with ones that they feel are very effective?
Through the chair, engagement with veterans is a huge part of what goes on, and meeting their needs for care, and specifically to PTSD, is the first priority.
Can I ask further then, have any of them suggested programs to you that are not included as options for them in PCVRS?
So the department is continually reviewing new and emerging treatments and the science that goes with them.
Can I ask where that list of treatments is? Is it possible for veterans to see all of those options? Would we as a committee be able to see which providers PCVRS is using at this time?
I don't have that information with me right now, but I would be happy to follow up with you.
And provide it to the committee?
I will certainly come back with an update.
A list. A list.
I will come back with an update of the information that is available.
Well, thank you, Madam Chair, and thank you, Minister and witnesses, for joining us. Through you, Madam Chair, we recently had a witness complain that every time he calls Veterans Affairs concerning his file, he gets a different caseworker, and therefore he has to start his process from the start every time he calls. I've been on this committee for 4 years since I was elected in 2021, and you are the 5th Minister of Veterans Affairs in the 4 years that I have been here, and the 9th Minister of Veterans Affairs since the Liberals were voted in 2015. What message does this send to the veterans who have had 9 ministers in 10 years and 5 in the last 4 years? What kind of care are you giving veterans? What kind of attention, what kind of priority are you making veterans?
Through the chair, ensuring that veterans have access to timely and compassionate care is what I am focused on every day right now. You mentioned that there has been a turnover of ministers, and that is accurate. What has been consistent, though, are the individuals that I referenced in my remarks just a moment ago with regards to the compassionate and incredible individuals that are engaging on a day-to-day basis with the Veterans Affairs staff, the team with Veterans Affairs, the case managers who are working with the veterans one-on-one on a daily basis. And that is the key, and that's part of why we're making the investments with the budget to be able to continue that care for veterans.
Madam Chair, I with all due respect, this feels like a I Love Lucy rerun, because I've heard this by every other minister that sat in here. So what do you expect to accomplish in the time that you are here? You've talked about timely and compassionate care. That's the same thing I heard from the last minister and the minister before, and we've not seen a change. We've not seen compassionate care. What we've seen are witnesses come forward complaining that they're not getting compassionate care. How do you expect to change this after 9 years? After 10 years, pardon me.
So the experiences that I've had in my travels differ from yours. I have had numerous veterans speak to me about the engagements that they've had with Veterans Affairs and with the individuals that are working directly with them in the positive experiences. You asked about how we will continue to improve upon that. That's part of why we're investing in the modernization so that we can...
Sorry, Madam Chair, I appreciate that answer, Minister, but with all due respect, if you're just getting the fluff from people that are saying everything's good and you're not listening to what's going on here in this committee and what's bad, you're never going to fix the problems that the veterans are dealing with. What are you going to do to fix the problems that the veterans who have been coming here are dealing with? Are you talking to them?
Through you, Chair, I am talking to veterans with a variety of experiences. I am talking to those that have had positive experiences, and I'm talking to those that have faced some challenging circumstances. I am speaking with individuals on our advisory committees that come with their lived experiences and the experiences of those around them. I am going out and visiting locations where veterans are coming together to give feedback. I had a recent opportunity in Calgary to meet with a number of veterans when I made a visit there, and there was both positives and opportunities for improvement.
Thank you. Through you, Madam Chair. I mean, we've had a witness that couldn't even get a ramp for a wheelchair, and she's asked for people to go and visit. I'm very happy to get her address and send you there so that you can tell her the experience, or she can share the experience that she's had. The experiences that veterans are having are not good, and we need to see a change. What kind of change are you going to bring to this table here?
So change will come with having the investment to be able to invest in veterans and to have sustainable long-term investment that is ongoing so that we can continue the progress that we are making.
Perfect. Merci beaucoup. Thank you.